Here begins the deposition of Wendy Parker. Today's date is December 4th, 2020. Time on the video monitor is 15:05. Would the court reporter please swear in the witness?
Please raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give in this case will be the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
Thank you.
Ms. Parker, I'm Doolin Kelly.
Sorry.
That's all right. And I represent Ralph Mulder. Be asking you some questions this afternoon. If you answer it, I'm going to assume you understood it. If not, please tell me you don't.
Okay.
And secondly, I'm going to assume you're answering my questions to the best of your knowledge and information. Will you do that as well?
Yes.
Tell me a little bit about your background, since I know nothing about it, your professional background.
I'm a medical assistant.
And how long have you been a medical assistant?
9 years.
And tell me who you've worked for since you've been a medical assistant.
Dr. William Russell.
What do medical assistants do?
Whenever the patients come in, I bring them back, take their vitals, ask them about their medicines, ask them why they're there, and then I go let the doctor know that they're ready, and I put all that information in the computer.
Do you make any assessment of the patient other than what you just told me?
Not really.
Give her that exhibit, and I don't know which one it is. It's this one. It's the office note.
Oh. 4.
Do you remember Ralph Mulder?
I know who he is, yes.
Okay. And let's look at exhibit number 4.
For the record, I said that. I may be completely wrong. Does it?
What's
Parker,
the-
does it have a sticker on there?
Yes, it
Yeah.
says 4.
Okay, good.
Okay. And it's dated November 13th, 2018. Tell me what we're looking at.
That is the office visit note from that day.
From that day?
Mm-hmm.
Do you have any independent recollection at all of that office visit?
Nothing other than what's here. I mean, that's
I understand.
been a long time ago.
For example, if I ask you, well, who was there on this date examining Mr. Russell, could you tell me who it was?
Say that again.
Yes. Do you remember who examined Mr. Mulder on November the 13th,
No.
2018?
No.
Now, I see your name
Yes.
under reason for appointment.
Yes.
Why would your name be there?
Well, because that's the information he told me right there.
Which is
So-
what?
That he was having tightness in his calves and unable to sleep at night due to the pain.
All right. Would you have recorded the rest of this, like assessments, treatment, any of the rest of this information?
Let's see. The encounter for pre-procedural examination, that was me because I printed out the labs. And our computer system is set up to do that. I did the weight. And here, if, like where it says admits, he said he was having pain and cramping in his legs, so that was me. And then the other stuff right here, that was me at some point, but that carries over every time.
All right, other stuff, meaning this.
The past medical history, surgeries.
Okay. Now, do you stay in when Dr. Russell examines the patient, or do you leave?
I leave.
You leave. Okay. Do you know of anyone else, you don't remember anyone else examining him besides Dr. Russell on that day?
No.
Okay. You're not saying there wasn't, you
Yeah.
just don't remember.
No.
All right. Now, let's take a look at the next record is right here in front of it. It's Exhibit 3, which I find your name on. It's right here. See it?
Yes, sir.
Okay, take a look at that for me just a minute.
Okay.
And what are we looking at?
That was the consent form.
Do you have any recollection at all about that?
Not really, other than what's there.
So if I ask you, well, what was said to Mr. Mulder or what Mr. Mulder said to you, you don't remember?
No.
All right. You did sign or initial the first page and sign the second page. Am I
Yes.
right about that?
Yes,
All right. Is this your handwriting on this form?
yes.
All of it?
All of it but the signatures.
Yes, that's what I meant.
Yes.
Okay. So let's begin with the very top part here. Who told you to write in aortogram with femoral runoff and angioplasty stenting and or atherectomy?
That's the standard for the procedures.
Okay. So you didn't have to, you knew that, you didn't have to be
Yes.
told that,
No.
right? Now let's go on down to the next paragraph where we talk about risk of the procedure. You see that?
Mhm.
Who told you to write in failure, bleeding, infection, and injury?
Those are the things that Dr. Russell goes over with them and the patient and talks to them. So I knew to put that in.
So this is standard as well?
Yes,
Okay. So you wrote these risks in,
yes.
and then when did Mr. Mulder sign this? Can you tell?
Standard is he would sign it after Dr. Russell talked to him.
Okay. But he didn't, you didn't tell him anything, meaning Mr. Mulder, about these risks or
Not
anything?
that I can recall.
I mean, wouldn't be your job to explain risks to the patient anyway,
No,
would it?
no.
Okay.
Not unless they asked a specific question, but no.
And you don't remember Mr. Mulder asking you any questions at all?
No.
All right. Now, notice that down here at the bottom, you've timed your signature at 9:40. Tell me why you did that.
I don't know.
Well, what,
Other than that's what time I had on my watch.
all right, I'm trying to get some context here. Does that mean this is a time when Mr. Mulder signed this form, or is this the time when you signed the form?
Possibly the time I signed the form.
Do you remember where Mr. Mulder was when he signed the form?
He would have been back in the
Operating suite,
pre-op room.
pre-op room. Okay. What's in the pre-op room?
It's just a bed and the vital sign machine.
Would Mr. Mulder have already been given his medications at this time?
No.
When does that happen?
The nurse gives it to him right before they go back.
Okay. So you think that Mr. Mulder signed this sometime, well, you don't know when he signed it, do you?
I don't know because
Was
it's
it
been too
before you
long.
signed it or after you signed it?
Honestly, I don't know.
I understand. It's been a long time, hasn't it?
Yes.
Now, Dr. Russell has also signed this and timed it at 10 o'clock. Do you see that as well?
I do. I see it.
Now, did he put the time and the date in?
Yes, that looks like his handwriting.
Okay. Were you present when he signed it?
Yes, I should be. I mean, can I say that for sure? I don't know, but that's standard.
Would he have signed it right after he explained things to Mr. Mulder? I mean, what's the custom and practice in your office?
Well, I mean, it just depends. It's usually signed fairly close, but
What?
he usually signs it after he's talked to him and before he goes out of the room.
Okay. Well, the reason I ask you that is it appears that if you look, I'll show it to you in a minute, that Mr. Mulder was given anesthesia at 9:55, which had been 5 minutes before Dr. Russell signed this consent form.
I don't know anything about that.
Okay. So you were not present when Dr. Russell explained anything to Mr. Mulder?
I would have been because my signature's on there, but I don't know when he got anesthesia.
Will you let me show that to you? Whoops. See it right there?
Dude, what page you on?
I'll tell you in just a second.
I said what page, yeah.
And what did he say?
He'll tell me in just a second.
Are you talking about on the side where it says anesthesia
Started.
start time? No. Okay, I see that.
Okay. And that would be on page, I just so we looked at the same record, but the page that I have, gosh. let's take a, we don't need to take a break. Hold on a minute. Just wait.
Yeah, that's what I was just getting at.
Wait, did I give that to you before, actually? Yeah, you.
No, but this is, you didn't give it to us, we brought it, but I've got it, just tell me the number.
I thought I handed that to you, though.
You handed me the
You handed us
Canova
Canova.
one. I think you handed this one, I think we brought this one.
Yeah, I brought that one, I printed
All
it off.
right, can you find it?
Well,
What I'm talking about?
do you have any page, do you have either of the page numbers on that?
No.
Let's
I'll
see.
be happy to show you what I'm looking at, but I don't think it's gonna help you. It'll show you what.
No, it helps. That's on the date. Let me see what I'm looking at here. That's at 1308, so that's before.
It's gotta be here.
This is a pre-op, I think, once it goes.
Should be after the customer. That's what they're-
It's right here. All right.
Look here, I got it right.
I got it, I got it. Oh, there you go. Put on the record that I was blamed for, just actually, oftentimes possible. So I've got, it looks like Mulder chronological at 324.
324, all right.
275 if you've got the non-chronological is when that appears to start.
the chronological is-
Yeah.
Which page?
324. Actually, 325 looks like a copy of 324.
Okay.
And then 326 is the.
Ms. Parker, we were looking at page 325. Can you
Okay.
identify that now?
I see what you're talking about.
I'm sorry, what?
I see what you're talking about, yes.
Okay. That indicates that anesthesia was started at 9:55.
Objective form.
That's what they wrote.
Okay. Now let's go back to an important question. You don't recall any discussion between Mr. Mulder and Dr. Russell about the risk involved in this procedure?
No, can I tell you exactly what he said? No. He goes over the risk with them, and if they have questions, they ask, and he answers, but
I know that's custom and practice, but it's important. You don't have any recollection of what was said that day.
no.
Okay. Who was responsible for striking out on that consent form those paragraphs that were not applicable? Was that you or someone else? And I'll show you what I'm talking about. Would that be helpful to you?
Yes.
All right, look on the second page,
Okay.
if you will. And I'll let you read where it says, authorize and consent to the presence of equipment representatives. Well, there wasn't any equipment representative there, was there?
I don't remember.
All right. And I understand, third paragraph, that there may be clinical students observing to participate in their clinical education. There weren't any clinical students there, were they?
Not that I remember.
All right. And then it says down at the bottom, I certify, I've read and fully understand the above consent to operate and/or invasive procedures, and explanations therein referred to were made, and all blanks and statements requiring insertion or completion were filled in, and all statements in the inapplicable paragraphs, if any, were stricken. There are no paragraphs stricken, are they? That you see?
I see what you're, not that
Uh-huh.
I see.
And my question is, and that was a long rambling question, is who was responsible for striking out the inapplicable paragraphs? Was that you?
No, because I've never struck anything out that I'm aware of, but I don't know.
So whose responsibility was it to strike out the inapplicable paragraphs?
Objective.
I don't understand what you're asking.
Well, it says that inapplicable paragraphs are to be stricken. You read that, didn't you?
Right here.
Yep. Who was responsible for striking those out?
I don't know that any is struck out, so I don't know.
Okay. The answer is you don't know.
I don't know.
Okay. Now, were you back in the operating room when the surgery was performed?
No,
Okay, so when's your last recollection of seeing Mr. Motor?
when I went out of the room, I would guess,
Was that the pre-op room?
yes.
Okay. Did you ever see Mr. Motor again?
I'm sure, but I don't remember.
All right, that's all I have.
Okay.
That's it, you're free to go.
Okay, thank y'all.
Time on the monitor is 15:21.